everyone, assalamu alaikum. Today our topic is an autonomic nervous system. Autonomic mean automatically. The function in our body that is performed automatically, not is in our control. What is doing in our body, like our intestine, how food digest in our intestine, how heart beat take place, how breathing take place, how bleeding take place, when we injured, how bleeding take place, how food storage take place. So all of these function that is automatically performed in our body, not is in our control, is autonomic nervous system, automatically performed in our body. Autonomic nervous system control that automatically situation that is performed in our body. Autonomic nervous system divided into two parts: sympathetic nervous system, sympathetic and parasympathetic. Sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system control our fight or flight situation. When we feel danger, when we see a lion, sympathetic nervous system control that type of the situation automatically. Now these fight or flight situation is controlled automatically, is in the is under the parasympathetic nervous system. Fight or flight, when we feel a danger, when we see a lion, we two type of the situation take place: if we fight or we run away, flight. And parasympathetic nervous system control our rest, digestion, food digestion, and urination. Our urine is controlled in parasympathetic nervous system. When our urinary bladder contract, we urine out of the body. And our digestion, our small intestine, large intestine, our stomach, and our peristalsis movement in our intestinal tract is controlled in under the parasympathetic nervous system automatically, not is in our control. And our rest, when we rest, our breathing rate and our heartbeat rate is as control in parasympathetic nervous system. But sympathetic nervous system is opposite the parasympathetic nervous system. It control our fight or flight situation. Suppose a heart, when we in fight situation, our heartbeat is increase and volume of the arteries in the heart is increase, because heart pump more and more blood. When heartbeat is increase, the pumping of the blood is also increase, and when blood pumping is increase, the arteries in the heart is dilate and volume of the arteries is increase. More and more blood is pumped to all part of our body, because we in dangerous situation. Automatically heart rate is increase, heart rate increase, and volume arteries. Arteries volume is increase. But in parasympathetic nervous system is opposite to the sympathetic nervous system, and it when danger is absent, when we feel normally, parasympathetic nervous system bring back these sympathetic nervous system into the normal situation. It keep the rate is low heartbeat rate low, and volume of the arteries is low. So it keep this situation into the normal situation. So both the sympathetic and parasympathetic nervous system keep our internal body homeostasis into the normal situation. Equal. Both these system keep our internal body situation into the homeostasis, into the normal. If one is in fight situation, other keep it into the rest situation. In lungs, when we in fight situation, our breathing rate is increase. When breathing rate is increased, the bronchi in the lungs, the space is increased, internal space of the bronchi is increased, bronchi is dilation of the bronchi take place. So more and more air can pass through these bronchi. Bronchodilation take place in sympathetic nervous system during bronchodilation. But in parasympathetic nervous system is opposite to the sympathetic. So here bronchocontraction take place. Bronchocontraction. So here bronchi is contract, and less air pass through these bronchi and keep the body into the normal situation, into the rest situation. So if one is increase, other keep them into the decrease, and body homeostasis become normal. So it take place automatically, not is in our control, is called autonomic nervous system. So in lungs, in gastrointestinal tract, in our small intestine, in our large intestine, the food peristalsis, food movement take place. So in a fight situation, gastrointestinal tract contraction take place. Vasocontraction. Contraction. So during in fight situation, gastrointestinal tract contract, the gastrointestinal tract contraction take place, and less and less food peristalsis movement, peristalsis movement becomes slow, and food digestion rate become slow during fight situation and sympathetic nervous system. But in parasympathetic nervous system is to the opposite to the sympathetic nervous system. So we write vasodilation. So during in rest, food digestion take place more and more, and food peristalsis movement rate is increase, and when food food digestion rate is increase, more and more digestion take place. Due to the vasodilation, food easily move in our gastrointestinal tract. In liver, during fight or flight situation, in the liver the glycogenesis take place. Mean the storage food in liver breakdown take place. Even fat is stored, breakdown take place during fight or flight situation. Our stored fat breakdown take place in the form of the glycogenesis and lipophases. But in parasympathetic situation, food stored again in the form of the glycogen, and fat stored again in parasympathetic situation, in rest situation. So liver, and after liver we write the skin. In skin, when we in fight or flight situation, our skin vasoconstriction take place, because less and less blood is movement take place, blood flow less and less take place, because arteries contract during fight or flight situation, vasoconstriction. And when vasoconstriction take place, less and less blood supply take place, and in fight situation, if our skin is injured, if our body is injured, this is good, because bleeding less take place due to vasoconstriction. During a fight situation, less and less blood flow take place, and in the skin less blood present here. If suppose we injured during fight situation, less bleeding take place, bleeding rate slow. But here in parasympathetic situation, the vasodilation take place. So when we in rest, our body skin is injured, bleeding flow rate become more and become high. So and sweating is also take place. Sweat sweating sweating because when we in fight situation, more and more sweating take place through the skin. And because due to the sweating, our muscles movement keep continue, our muscle movement continue move due to sweating. So this is good. And here in sweating rate is low, here sweating rate is high. Muscle movement become high due to sweating in fight situation. If sweating is not take place, our muscles become stuck and become difficult way for fight. So this is our today topic lecture: autonomic nervous system, sympathetic and parasympathetic nervous system. And internally in our body, this is we called visceral system. The body, in our body, the heart, lungs, livers, gastrointestinal tract, so all these things we call visceral organ. This is visceral organ that we cannot touch. That we cannot touch is visceral, and we cannot see is a visceral organ that is present in our body: heart, lungs, gastrointestinal tract, etc. So all these during during fight or flight situation, sympathetic nervous system control that situation in our heart, lungs, liver, gastrointestinal tract, skin. And parasympathetic nervous system is opposite to the sympathetic nervous system and keep our body into the normal state and maintain our internal internal homeostasis, body homeostasis in normal. So hope you understand. Okay, laugh is bye. In kidney, in our kidney, during fight or flight situation, the vasoconstriction take place. Because the arteries become contract and less glomerulus filtrate take place. Glomerulus filtrate rate becomes slow. Glomerulus filtrate rate becomes slow due to vasoconstriction and less glomerulus filtrate take place, and less due to vasoconstriction, blood supply become slow to the kidney, and due to the less blood supply due to the kidney, glomerulus filtrate rate also becomes slow, and urine formation rate become low. Urine rate become low. But in parasympathetic situation, the vasodilation take place. The arteries in the kidney become dilate, and more blood flow rate become high. Blood flow rate become high, and glomerulus filtrate rate also become high. Filtrate rate become high, and more filtration take place. Urine formation become high. Urine become high, and when urine become high, the urinary bladder contract, and we urinate. We urine out of the body during parasympathetic situation.